So, what actually makes healthcare good? It seems like a simple question, right? But the answer is incredibly complex. Today, we're going to dig into the story of the man who first gave us a real, clear way to figure that out. A man whose ideas have touched almost every part of modern medicine, even if you've never heard his name. This is the story of Avedis Donabedian.
When you hear people in public health talk about Avedis Donabedian, there's one word that just keeps popping up: giant. And that's a big deal. I mean, think about it. How often does pretty much everyone in an entire field agree that one single person had that much of an impact?
Okay, so who was this giant? And how did one beautifully simple idea completely change how we answer that fundamental question in medicine? Are we actually doing a good job? Well, let's dive in and find out.
Now, to really get a handle on Donabedian's revolutionary ideas, you first have to understand the man. And his story, well, it doesn't start in some pristine laboratory. It starts right in the heart of a family shaped by the tragedies and triumphs of the early 20th century.
He was born back in 1919 in Beirut to Armenian parents, and his family's history is just this incredible mix of unimaginable loss and pure resilience. His mother, she was a survivor of the Armenian genocide. She endured forced marches that took almost everyone else. And then you have his father, who was this devoted village doctor in Ramallah, a real symbol of healing. So you've got this intense suffering on one hand and his deep-seated desire to serve on the other. It's that combination that really forged his worldview, long before he ever set foot in America to study at Harvard.
He talked about his mother's harrowing journey himself. He said she survived when literally all of her other family members were gone. He described her as brave, tough, resourceful, intelligent, and that wasn't just some family anecdote for him. That deep personal understanding of what it means to survive against all odds, that became the absolute foundation for the incredible humanity that you see in all of his work.
But here's the thing. Donabedian never actually set out to be this world-famous scholar. Not at all. He was just a doctor, doing his job. And his whole journey into research, it started with a really simple but super frustrating problem he just couldn't figure out on his own. So he's back in Beirut, working as a doctor at a university, and he starts noticing these weird patterns of sickness in the students. He even gave it a funny name, Mrs. Smith's disease. It totally fascinated him, but he just didn't have the right tools to figure out what was causing it. And on top of that, he was running into another problem. He knew medicine, sure, but he had zero clue how to actually run the place. The administrative side, like managing a clinic or handling a budget. So what does he do? He goes to his dean looking for answers. And the advice he got, well, it changed his life forever. The dean told him he needed to study two fields, epidemiology and health services administration. The funny part is, Donabedian later admitted he'd never even heard of them. But that was it. His curiosity was sparked. And that one piece of advice sent him all the way across the world, to Harvard, putting him on a completely new life path.
So he gets to Harvard, and his mentor, a guy named Dr. Leonard Rosenfeld, gives him what sounds like a pretty simple assignment. He says, try to find and read all the material written so far on the quality of medical care and give me a summary in 6 months. Simple, right? Well, that little assignment became his life's quest. Seriously. 40 years later, Donabedian joked, "I have not stopped." And that quest, that 40-year obsession, it all led to one single, powerful idea. An idea so simple, yet so revolutionary, that for the first time ever, it gave us a clear, systematic way to actually define and measure what good healthcare even is. See, here was the problem he was trying to solve. Everybody talked about quality of care, but nobody could really agree on what that meant. How do you know if a hospital is doing a good job, or if a doctor is effective? It was all just feelings and reputation. There was no system, and Donabedian was determined to change that.
And his solution was just genius. He took this fuzzy, vague idea of quality and broke it down into 3 simple, measurable chunks. First up, structure. This is basically the where of healthcare. Do you have the right stuff, good equipment, qualified staff, a safe hospital? Then there's process. That's the what and the how. Are doctors doing the right things, like getting the diagnosis right and communicating clearly? And finally, the most important part, outcome. What happened in the end? Did the patient's health actually improve? Are they satisfied? Structure, process, outcome. It was like he handed everyone a roadmap for something that had been completely uncharted territory before.
Okay, let me put it this way. Think about baking a cake. The structure is your kitchen. You've got a good oven, fresh ingredients, a clean space.
The process is what you do, mixing everything just right, baking it for the perfect amount of time. And the outcome? Well, that's the delicious cake you get to eat at the end. It's the exact same idea for healthcare. If you have the right structure and the right process, you should get a good outcome. It's such a simple, common-sense way to look at a really complicated system.
So, this all came out in 1966. Donabedian publishes this groundbreaking paper that lays out the whole framework. And with that one article, he didn't just add to a conversation. He literally created a brand new field of research. He gave everyone, from doctors to hospital administrators to policymakers, a common language and a blueprint to start making medicine better for all of us.
But if we just stop at the framework, we're totally missing the soul of the story. Because that model, that's only half of it. To really get what he was all about, we have to look at the extraordinary man behind the science.
I mean, this guy was so much more than just a brilliant academic. He was a poet, a huge lover of literature. He was fluent in 6 languages. And get this, he wrote his entire life's work by hand with a fountain pen. I mean, who does that? His influence spread all over the world, to the point where foundations were named after him in places like Spain and Argentina.
And for all his scientific achievements, all the data, all the systems he created, near the end of his life, he said something really telling. He said, "It is the poetry that tells the most about who I am." And that one sentence just tells you everything. It shows you that his heart wasn't just in the numbers, it was in the humanity of it all.
He actually wrote a poem called Departure as he was facing the end of his own life. And in it, he says, "I do not go, as the poet says, raging against the dark. There is no darkness where I go, only sweet light." It's such a beautiful and powerful look into a man who met his end not with anger, but with a sense of peace, acceptance, and love.
And this all leads us to what might be his most important insight of all. After a whole career designing systems and frameworks to measure quality, he basically said the secret isn't in the system at all. The secret, he said, is love. He believed that if you don't have love for your patient, love for your profession, then the whole structure, process, outcome thing, it's all meaningless. It has to be built on a foundation of real human compassion.
So in the end, Avedis Donabedian gave us the blueprint, the structure, process, and outcome to build a better way of caring for people. But his life, his story, it leaves us with a much bigger question, one for all of us to think about. Can a system, any system, no matter how perfectly designed it is, ever be truly excellent if it doesn't have compassion right at its very heart?